Guillaume, we've been working together in the Transforming Integrated Care in the Community project. Can you tell me what's the best thing for you about trying to bring the Buurtzorg way into French health and care?
What's the best thing? I would say for me is to have the opportunity to work with the Buurtzorg people. I mean, for me it gave me the opportunity to be there and experiment. When they say quality of relationship is key, then I can say I have experimented quality of relationship with them supporting me, having real, human connections, very straight, simple, but warm.
Right.
So I would say for me, experimenting this quality of relationship personally, that's the best for me.
And what's been the biggest challenge of trying to bring the Buurtzorg way into the French system?
What's the biggest challenge?
Yeah.
I would say the biggest challenge for me is the per act payment system we have for nurses in France, which means on the mainstream system you get paid for what you do, and there's a very big list of things, but still not covering what the people really need. So it's 90 different items, but that doesn't cover more than 60% of the real need of people at home. And so that's the main, I would say that's the main challenge compared to Holland, for example, where you can do holistic care and you can get paid for it. In France, you can do it, but you're not paid for it.
Right, I get you. And one last question, Guillaume. If looking back on 4 years of this project, 2 of those years have been the COVID years, so that's changed everything. But looking at it as a whole, if there's what's the biggest, what do you wish you'd known at the beginning that you've learned through the project?
I wish I had known that's so important to take care about who you will hire first. So the first nurses to join the project, I think are really key, because then you will clone them along the time. And this is something I read, that Jos had hired like 50 and more year-old nurses with great experience and great willingness. I read this, but I didn't do it. Now I say, okay, you know it, but you don't do it, then you can see the outcome if you don't do it. So I would advise not to do like me, and read it, know it, and do it.
Okay, thank you very much, Guillaume.